Well, how do you know if you have reflux? That's probably the most logical question that's next. Well, just like any other thing in medicine, we've probably got a dozen different tests that we could throw at you if we want to. But when it comes down to reflux, it's really a simple 3 tests that we need. One of which is a barium esophagram or barium swallow. This is where we send you over to radiology, we have you drink a glass of god-awful tasting liquid, and they take x-rays as it's going down. It's a good screening test. It picks up advanced abnormalities with the esophagus or stomach. But probably the best and the most sensitive test is something called an upper endoscopy. And what that is where we put you to sleep, we take a small camera, we take a look down in the esophagus, and we can actually see what's going on, see what complications you may have experienced or developed because of reflux. During this test, we can take biopsies of any of the tissue that may look abnormal. Like I said, this is probably the most sensitive test, and this is the test I would recommend anybody with reflux to have if they've had symptoms for more than about 3 to 5 years. The next test is what's called esophageal manometry or motility testing and pH testing. These are very sophisticated tests where we can actually measure the strength of your esophagus as well as the strength and function of that valve. The pH test has the ability to actually measure how much reflux you're having, meaning how many episodes, how long they last, when they occur. And this really serves as the gold standard in not only diagnosing reflux, but more important, determining the severity of reflux. For purposes of tonight, however, probably the best thing that you can understand is really what are the symptoms of reflux, because I think here is where a lot of people are confused. I think most people, patients as well as physicians, think that reflux is heartburn and heartburn only. Well, truth be told, heartburn doesn't even have to be present to have bad reflux. In fact, about 30% of the people won't have any heartburn whatsoever. They've never experienced heartburn, they don't know what heartburn is, and yet they've got severe reflux with other symptoms. And what these other symptoms can be is regurgitation. What regurgitation is that ability to bring up the contents of your stomach at the most inopportune time. What people describe to me as bending over to pick a pencil up off the floor and revisiting Taco Bell. Very common symptom associated with reflux. Epigastric pain, that's pain right here at the bottom of your breastbone, is a very common symptom associated with reflux. A bitter or a bile taste in the back of the throat. That's the acid and the bile coming up and getting into the back of your throat so you can taste it. Chest pain or a heart attack. It's estimated that about 30 to 40% of all the patients that present to the emergency room thinking they're having a heart attack, turns out their heart is fine, that their symptoms, their chest pain, is from reflux problems. They're doing the right thing by going to the emergency room. Anyone with chest pain obviously needs to go to the emergency room, but over a third of the time it's going to be due to reflux. Difficulty swallowing, this can be a symptom as well as a complication of reflux, which we'll go over in more detail here in a little bit. Persistent nausea and vomiting. The bile in that fluid that makes up your stomach, when it gets up into the esophagus, can produce a horrific nausea. Persistent sore throat, as well as unexplained weight loss, asthma. It's estimated that about 30% of all the adults that develop breathing difficulty as an adult or diagnosed with asthma, they don't have asthma, what they have is reflux. And I'll get into the mechanism of that here just in a little bit. Recurrent pneumonias by a similar mechanism can be caused by reflux, as well as bronchitis, a persistent cough, dental erosions. Believe it or not, we get a lot of referrals from dentists because patients are now losing their enamel on their teeth from reflux. Persistent bad breath can be a symptom of reflux, as well as hoarseness and voice changes. Excessive belching, as well as the sensation of a lump in the throat, are all symptoms of reflux. And this is just a partial list, and this isn't meant to commit to memory. This is just to give you an example that reflux is much more than just the inconvenience of heartburn. It has a lot of other symptoms associated with it. Well, is this a serious problem? Well, obviously I wouldn't be up here, I wouldn't be talking to you right now if this weren't a serious problem. But this is, I think, where we've lost a lot of communication between the physician and the patient, because they don't tell you about the complications and the risks associated with reflux. So we're going to spend a little time going over the complications of reflux. Probably one of the most common complications is that of esophagitis. And what that is just simply inflammation of the inside of your esophagus due to reflux. That acid and bile and pancreatic enzymes, when it comes up into the esophagus, basically produces a chemical burn of the inside of your esophagus. It's really an erosion due to that acidic and caustic material. This picture here on the right-hand side is a picture of endoscopy. So this whitish area right here is the normal lining of the esophagus. Right here, these red linear streaks, these are these chemical burns on the inside of your esophagus that are due to reflux. The only way that we pick these up is during an endoscopy. It really has no symptoms other than your reflux symptoms. Now that's a very mild case of esophagitis. It can get so bad that your esophagus actually starts to look like hamburger, which is pictured here in this middle picture. The esophagus can start to bleed. That damage to your esophagus over time will then lead to the formation of scar tissue, which is represented here in this third picture. That scar tissue we call strictures of your esophagus. The esophagus is a very narrow tube to begin with. If we put scar tissue in it from the healing of that esophagitis, it tends to narrow the esophagus over time. That narrowing will then lead to difficulty swallowing or dysphagia. So now all of a sudden when we try to woof down that Big Mac feels like it's sticking in the middle of our chest. Other complications of reflux, there's something called poor motility. Your esophagus is really just a muscular tube, and it squeezes to push your food down into the stomach. Food just doesn't go from your mouth and fall via gravity into your stomach. It's actually pushed by this muscle. Well, the bile in that gastric fluid, that stomach fluid, is very toxic to that muscle. And so after years of having that fluid and that bile come up into your esophagus, it damages that muscle to the point where the muscle doesn't squeeze anymore. And if the muscle doesn't squeeze, again, food is going to be sticking in the middle of your chest. The next set of complications I want to go over are what we refer to as the pulmonary and ear, nose, and throat complications. This diagram here represents your esophagus as well as your trachea. So up here in red is your stomach. Coming up your chest is your esophagus here. At the top, it shares a common cavity with your windpipe or trachea. So people that have bad reflux, the fluid within the stomach can come all the way up the esophagus, get into the back of the throat, and go down into your trachea or windpipe. When it does that, it causes bronchoconstriction or bronchospasm of the airways, which will resemble and look a lot like asthma. We have patients that come in and have been treated for years with steroids and inhalers. Finally, somebody realizes that this may be due to reflux. We stop their reflux, and lo and behold, their asthma goes away. Similarly, cough can be a complication or a symptom of reflux. Again, that fluid from your stomach comes all the way up into the back of the throat, irritates the back of the throat, which then leads to the cough. Pneumonia by a similar mechanism. There's bacteria in that fluid of your stomach. That bacteria comes up when you reflux. That fluid and bacteria thing can get into your lungs, which then produces a horrific pneumonia, something we call an aspiration pneumonia. Well, it can also lead to inflammation of the airways, or what's called bronchitis, and then over time, with ongoing damage to the lungs from reflux, that will lead to scar tissue formation. Scarring in the lungs is called pulmonary fibrosis. Basically makes the lungs stiff. So now the lungs can't open up to breathe. This is a permanent change or permanent damage done to the lungs. One of the major lung transplant centers in Texas recently looked at all the patients that they were treating for something called idiopathic pulmonary fibrosis and found that over 35% of them, the reason they were transplanting them new lungs was because of reflux damage to the lungs. The other thing that was interesting that they found was that if they didn't do something to stop the reflux in those patients, after transplanting them new lungs, those patients would immediately damage those new transplanted lungs. So again, reflux can lead to a lot of serious problems. In this case, like I said, pulmonary problems. It can also lead to what we call ear, nose, and throat problems, such as voice changes, hoarseness, ear infection, and sore throat. Similar mechanism here, that acid and bile and pancreatic enzymes comes all the way up into the back of the throat. The vocal cords are located right here at the top of the trachea. That caustic material gets on the vocal cords and again causes inflammation and scarring, which can lead to voice changes, hoarseness, and even permanent voice changes. There's also a small little tube that drains down here from the ears. When that fluid comes up with the bacteria, it can get into that little tube that goes up into the ears, leading to ear infections. And then obviously that caustic material coming up into the back of the throat is going to eventually produce erosions in the back of the throat or a sore throat. Probably the most serious complication related to reflux, however, is something called Barrett's esophagus. And this is where I'm going to spend a little bit more time on Barrett's just to go over this, because I think most of the primary care physicians, as well as the gastroenterologists out there, don't take the time to explain what Barrett's is. So simply put, what Barrett's is a change in the lining of your esophagus. Your esophagus normally has a tissue paper-like lining in it. It's not meant to see the acid and the bile and the pancreatic enzymes coming up. Well, what the body does over time after being exposed to that much caustic material is it attempts to change its lining. So the esophagus attempts to change its lining to a tougher lining, like that of the stomach or the intestine. When it does that, that's termed Barrett's. All right? So simply put, Barrett's is just a change in the lining of the esophagus. As I said, it's secondary to chronic exposure of gastric contents, meaning that acid and that bile. It's going to occur in about 10 to 15% of American people. It's much more common in males, but can occur in females. The biggest thing they don't tell you is Barrett's is a precancerous lesion. This picture here on the right is illustrating Barrett's. Again, the whitish pink area here is the normal lining of the esophagus. This beefier red lining here is Barrett's. The other thing they don't tell you is the formation of Barrett's is probably due to the bile in the stomach, not the acid. So it's the bile exposure over time that causes the body to change from one tissue type to another. If you or anyone you know is ever diagnosed with Barrett's, it's important to know the type. There are actually 3 different types of Barrett's esophagus. There's Barrett's with no dysplasia, Barrett's with low-grade dysplasia, and Barrett's with high-grade dysplasia. The term dysplasia just means chaos, sort of at the cellular level. In other words, when we look at these cells under a microscope, if the cells look pretty normal, then that's termed no dysplasia. If they're looking a little bit chaotic, that's termed low-grade dysplasia. And if they're very disorganized, very chaotic, that's termed high-grade dysplasia. So Barrett's with no dysplasia, so the body's done the best job it can from changing one tissue type to another, carries with it about 40 times the risk of the development of adenocarcinoma of the esophagus. What that translates into is about a 0.5% to a 1% risk per year of developing adenocarcinoma. So in other words, at the end of 10 years, that's a 5 to 10% chance that I'm going to develop esophageal cancer. Barrett's with low-grade dysplasia carries with it about 2% risk per year. So now, that 10 years, now I've got a 20% chance of having esophageal cancer. High-grade dysplasia, 40 to 50% of the people with Barrett's with high-grade dysplasia will already have esophageal cancer at the time of diagnosis. In the old days, somebody with high-grade dysplasia, we would take them to the operating room and take their entire esophagus out. And when we did that, in about 50% of the time, we would find an invasive cancer in the esophagus somewhere. We couldn't see it with the naked eye, but once pathology looked at it, almost half the time they would find an invasive cancer in that esophagus.